For those of you who don't know me, I'm Rob Kinsvater. I'm the Director of the Division of Budget Analysis, and I have been given the distinct honor today to introduce you to our new Secretary, Dr. Mandy Cohen, who was most recently the Chief Operating Officer and Chief of Staff for the Centers for Medicaid and Medicare Services. In this capacity, she held responsibilities for implementing national policies for Medicare, Medicaid, and the Children's Health Insurance Program, all of which, of course, are deeply ingrained in the work that we do. Dr. Cohen is a graduate of Cornell, Harvard School of Public Health, and Yale School of Medicine. I've heard those are pretty good schools. And she trained in internal medicine at the Massachusetts General Hospital. We're doing this a little bit differently today. We are doing an interview, and I feel truly honored to be the interviewee today. I'm going to ask the Secretary some questions. She has some thoughts she wants to express about why she came here, her leadership style, and so we'll look forward to that. The second half should be really fun. She's being an incredibly good sport, and I'm putting myself probably at incredibly big risk to pepper her with some questions, personal questions, to get to know her, and maybe to put her on the spot, although she's been on Capitol Hill many times, so I'm sure she'll be well prepared for this. So I will just start off with the first question. What originally inspired you to pursue a career in medicine?
Well, thanks. And before I jump in for the first question, just want to say, hi, y'all. How'd I do? It is great to be here. I am so honored to be trusted by the governor to take on this job here. I couldn't be more excited. Seeing all of your faces out there makes me even more energized to really roll up my sleeves and get started with the work. So this is just really exciting. All right, sorry, now you're going to have to repeat the first question.
That's all right. What originally inspired you to pursue your career in medicine?
All right, so I'm a physician by training. I trained in internal medicine, which means I'm a primary care doc. And the inspiration for that really goes back to my mom. She is a nurse practitioner. She has been for almost 40 years. She was one of the very first nurse practitioners in New York, which is where I grew up. She was part of a pilot program when folks were thinking about using nurses in different roles. She worked in Kings County, which is in Brooklyn, and trained there. And she's been nurse practitioner ever since. She, bless her heart, is still working in an emergency room at night. I'm trying to get her to retire because she loves her job. She loves being a clinician. She loves her patients. She loves the work that she does. And the reason I went into medicine was because I was watching her and I wanted to be like my mom. And mostly it was the moments of when we were in the grocery store and someone would come and say, Dr. Susan. And she was like, oh, I'm a nurse practitioner. And I was and they would thank her so much for the care and time that she took, and when they were in a moment of crisis for their lives. The reason I then also probably took the step into the policy world is also because of her working in an emergency room. She would come home and tell us about all the broken parts of the healthcare system, and there are, we know as folks who work in this very complex world that it's a tough world to navigate out there, and there's always improvements we can continue to keep making, and a lot of those problems show up in the emergency room. And so I would hear about both this amazing clinical work that she was doing, the lives she was touching, but then the problems of our community, of the healthcare system as a whole that would show up in the emergency room. And I'm the kind of person, some people, I will tell you, said, why would you ever go into medicine? It's terrible, it's falling apart. And I said, sounds like they need some good people to help out, and let's see how we can do better and fix things. So you'll see I'm a kind of person that runs to a problem. I embrace the challenge that comes there, and that really does start back from my mom and hearing about that work. I will also say, and this is really for all the women in the room, my mom's brother is a physician. My mom is a nurse because when she was growing up, women didn't go to medical school. So it was very important to her. Wow, I'm gonna, so you've only one question in and I'm already crying. He's amazing. So, you know, women didn't go to medical school, and so it was a very big deal for her to have a daughter who went to medical school, and so that was important.
You're also incredibly efficient because you already answered the first 3 questions.
Sorry. Okay.
So obviously you spent time at CMS during an incredible time of change in Medicare and Medicaid. What are you most proud of in your work at the national level?
Gosh, it was such an incredible experience in a moment in time for our nation, for healthcare. I joined the team at the Centers for Medicare and Medicaid Services a few months after the Affordable Care Act was passed, which was sea-changing really for not just the coverage pieces, but really for how medicine was practiced and how we think about the system. And it was just really exciting to be there. My first job there was thinking about how do we think about payment to physicians and hospitals and other providers to think about outcomes differently and think about getting more value out of every dollar we spend. And so those are my first jobs at CMS. But the thing I'm most proud of is the number 20 million, and that's the number of people who gain coverage because of the Affordable Care Act. There were some very hard times to get to that place. So that work is not easy, and I know a lot of that work lived right here in the work that you do every day, contributing to that number. But it was such an honor to be at the national level and working on policy, and a lot of my role had to do with the execution of the policy work and implementing the work. And it was just an incredible opportunity, and really to always go back to that individual person whose lives were touched, who never had health insurance before, who worked 2 part-time jobs, who hadn't gone to the doctor in a really long time, but finally was able to, unfortunately got their mammogram and found something on it, but you know what, was early enough, they were able to take care of it and get the care that they needed. I mean, that's why I come to work every day. I'm sure it's the reason many of you come to work here every day, and it's what I'm most proud of.
So what interested you in coming to North Carolina, and what excites you most about taking on this new role?
Well, clearly I came for the barbecue. And we just had a meeting with some of the senior team, and we went around and everyone was telling me their favorite restaurants, and you will see I'm kind of a foodie. I like food. So I heard there's great food down here, so sign me up. No, so I got a call out of the blue from some folks on Governor Cooper's team and said, would you be interested in having a conversation? And I will say it was 6 years into federal service, and it was a lot. I'd been running hard for a long time, and I didn't honestly think that government service or continued government service would be in my future. But as I neared the end of that tenure, I didn't want it to be over. And I just think government service is just an incredible opportunity, and I just don't think there's a better job. It's so mission driven. You are making an impact in people's lives every day, and that's why I came. And when the governor offered me the opportunity to work here, and hearing his vision about building and on the things that have already been done here, and to move North Carolina in a direction that's going to be healthier, I couldn't have thought of any more exciting work that I could possibly be doing. I asked my husband, hey, honey, they have some great barbecue in North Carolina. What do you think? But without missing a beat, he was like, we have to go there. We have to go as a family, and I'm excited, we as a family are excited about the opportunity to learn with you and to work with you and to do great things together.
There's an Eastern-Western barbecue thing. We'll have to get you
I hear that. I hear that. Mm-hmm,
but they're both great. So what do you expect to be your first 30 to 60 days to be like?
So, I'm, I don't know, 5-6 days in, and it's been great. So what I hope to do in this beginning time is a lot of this, so sharing a bit about myself, but really it's listening. It's a lot of listening. I have some background in this, but I don't know North Carolina, and I recognize that, and I need to learn from you and your experiences. So you'll see we'll end early here, and I hope to meet some of you, and I want to hear about what's going on. We'll do some additional smaller staff meetings with some of the individual components because I want to know what's going on the ground. How are the families of North Carolina faring? How do you like your job? What are things that are going right that we need to build on? What are the pain points that we need to work on? So I'm going to be doing a lot of listening, not just hearing, but really listening. And that won't just be here at HHS, but it'll be to all of our external stakeholders as well, understanding from their perspectives about their priorities, what they have been seeing, and so doing a lot of listening. I will commit to, I also want to make sure that I get around the state as well. I want to make sure I'm just not getting a too Raleigh-centric version of what's happening. So I'll be doing some traveling around the state and meeting some of our a team in other parts of the state. I certainly want to hear from the counties, our critical partners in executing the work that we have to do, and understanding how their work is going, how we can support them better, how we can work more closely together in partnership. So I'll be doing that, and clearly our stakeholder community, and I'm going to make friends with the legislature as well. I've already started. They are a very committed group of folks who care passionately about North Carolina. I think there's a lot of alignment beyond the bluster of what you may hear with confirmation and all of that. I will say I met yesterday with 5 or 6 of the leadership, and they care so deeply about this work and are so supportive. And they want a lot of the same things we all want, which is to help our community be healthier, be safer. And I think there's going to be a great working relationship there. So I'm learning about their priorities and seeing how we integrate that into the work that we do as well. And I'll commit to you, we're going to have another staff meeting in about 60 days from now. And I'll come back to you after I've done that listening and share a bit more about what we're going to hope to accomplish over the next year, 2 years, 4 years, 8 years, 10 years here at the department. So I look forward to building that over the next few months.
So as secretary, what are some of the words that we will hear you say most often?
Yes, so I'm repetitive. You will see me have a laser focused on who our boss is, which is the people that we serve, the patients, the consumers, the families, the communities that we serve. And so there won't be a meeting that will go by. So there won't be a meeting that goes by that I won't ask, how is this going to impact the life of a child, a parent, a teacher, one of our union members, right? I want to know how it's going to impact individuals' lives. So you hear me say that a lot. You'll also hear me say team, 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 a lot. And I want to give an example of what I mean by team because I think it's important. and it'll be more than saying it, right? You have to live it. And so here's what I mean by team. So one of the things I do hope to focus on is something related, is tackling the opioid crisis. That's not just here in North Carolina, but really across the nation. But I think here in North Carolina, we have all of the pieces that we need to really tackle this problem, get our arms around it, and lead the nation in it. And that's what I want to do. But it's not a mental health problem. It's not a Medicaid problem. It's not a public health problem. It's everyone. Everyone has a piece of this work. Procurement, budget, IT, comms. We all have a piece of of this work. And so what you will see me do is think more about problem-based and team-based work. So we will tackle it as a team. And it doesn't matter whether or not you work for Medicaid or you work for folks in public health. It'll be one team. And that means talking to each other, breaking down those silos, being transparent about what our work is, and really communicating. And I hope we will model that as a senior team. You hold us accountable to that teamwork, so it's not just me saying those things, but it is us doing it. So you'll hear me talk about our consumers, you'll hear me say team. You will also hear me say the word execution, and I don't mean I'm killing anyone, and I mean operational execution, and focus on how we do our jobs every day, and thinking about big and small ways in which we can do that better every single day. So you'll hear, I care about the policy and getting that right, absolutely. I want to make sure we talk about it in the right way, because even when you get the policy right, if people don't know how to, they don't hear it in the right way, it could get misunderstood. And then go laser focus on getting that execution down. So you'll hear a lot of repetitive execution from me. So.
Well, thank you so much. We just had our first management team meeting, and I'd just like to say how personally inspired I was by the conversation we had this morning, and how excited we are to get to work. So
it's gonna be fun.
We're moving into the lightning round.
Oh, lightning.
So I have a series of questions that we're going to go really fast.
Okay.
Because we got to get the yoga people here on time.
Got it.
Where are you originally from?
New York. It's okay.
And your husband is an attorney, you mentioned?
Yes, we still love him. He's a lawyer.
What type of law does he practice?
He practices healthcare regulatory law. And I'll clear up for the record right now. So there's always some blogs and things. He does federal Medicare policy. None of the work will interact here at the department, so we don't have to worry about any conflicts and things like that. But he's a great attorney, but even a better dad. So, yeah. He's home single parenting my girls right now. So.
That's the next question.
Okay.
I understand you have 2 young girls. How are they acclimating to the move to NC?
Oh, well, so I have a 2.5-year-old and a 5-year-old, 2 daughters, Sophie and Evelyn. We're not all quite here in North Carolina yet. We will be by mid-March. So Monday to Thursday I'll be here. And like I said, my husband will be single parenting, God bless him, and he's doing great. He's doing great 1 weekend, and so we will move down in mid-March, and they're very, very excited for the move. They told all of my daughter ran into her preschool class the first day after we talked about it with her, and we hadn't told our friends yet, and she blurted it out, and by 20 minutes later I was getting texts and emails from all the preschool moms being, I hear you're moving to North Carolina. I was like, yes we are, sorry. You had to hear that through my daughter and not from me personally, but yes, they're very excited. They're very excited.
And you have other family in public service as well?
We're a public service family. So my sister works for the Department of Education in New York City. My sister's husband works for New York City Council. And yeah, so we are public. We already heard about my mom. My dad is a retired guidance counselor who worked his whole career in New York City schools, and he was a special ed guidance counselor. And yeah, so folks who are very dedicated to public service, and I learned a lot from that, as you can see from my family.
Fantastic. Now, you attended 3 Ivy League schools. Do you have anything specifically against Dartmouth or Princeton?
They're wonderful. They're wonderful schools, I hear. It was clearly never the intent to sort of do the tour of schools, but I was very, very lucky, very lucky.
When not serving as Chief Operation Officer of CMS, and now our new secretary, what else do you like to do?
Play with my kids. I was going to say eat again, but I think I've already told you guys that I like to eat. I like to go out to restaurants, like to spend time with our friends, and most importantly, I like to be outside. So you will see me enjoy this beautiful campus. Our leadership team will see that when we have one-on-one meetings, we'll be doing it with sneakers on and walking around this campus. So.
So what is the strangest thing that's happened to you since you've come to North Carolina?
Strangest thing, I mean, it's been pretty normal. I mean, look, this whole experience is a little bit surreal. I feel very lucky to be here. I think probably the strangest was the press conference itself that announced me. It was just different than our experience in Washington, D.C., and where no one asked me what I was going to say in front of the camera before I said it, and they were very trusting, and I was like, wow. You don't even know me yet. That was very trusting, and I'm very appreciative of the freedom and flexibility, but that's what I think that I have come to really respect and like about the governor, is he's chosen an incredible team to put around him who he knows are going to, take his vision and run with it. And so that's been really, really exciting.
What is the most interesting thing we would learn about you that would not show up on your resume?
So I'm a musician. I play piano, violin, I sing. I like to sing. So I hope to find a group to sing with while I'm down here in my free time. I sing. And I've sang in places all over the world. In college, got to sing with a fantastic singing group, and I think the most interesting place was singing for the president of Taiwan at the Presidential Palace, which is just so unusual, my only trip ever to Asia, to get to sing there. So that's maybe at a future event, someone might be able to convince me to sing something. Can't promise.
Love to hear that. If you could master one skill that you don't currently have now, what would it be?
I would love to speak another language. I am not great with languages. I don't know why. But I would love to know another language and give me the opportunity to immerse myself in another culture in that way.
Now, you're a physician.
I hear that, yes.
What food do you most like to eat that you absolutely know is terrible for you?
Oh, there's so many. How do you choose? I probably can't live my life without ice cream. I mean, it's just, I can't imagine it without that, but probably also can't live without pizza. So it's so hard to choose, but I hear the barbecue here is, like I said, real good, and so never know, that may jump to the top.
We'll add that in the mix.
Yeah.
What is something strange you carry in your purse?
Oh, God.
I mean, not to be personal.
Not to be personal. I mean, not that you're prying. So Ben, who is going to be our head of our lead shop, saw this yesterday. I carry around tea bags in my purse because I'm a huge tea drinker, and I'm kind of particular about the tea I want to drink, so I just carry it with me. And so the only things I order are cups of hot water, and then I have my own little tea bag. I know that's so weird. Sorry.
We've just opened up your Netflix account. What would we see under most recently watched?
Well, my 5-year-old would have likely just had it, and it would be Daniel Tiger, clearly, is the thing that would have been watched by her. But I also, like I said, I'm a foodie. I watch a lot of food-related documentaries or documentaries about, 3 or 4-star Michelin restaurants and things like that. I'm really fascinated by folks who are at the top of their craft. The just incredible dedication and just like they're totally consumed by perfecting their craft to get it to that level, and I'm just so fascinated by it. You should watch this documentary about this older gentleman in Japan who runs a very tiny small sushi restaurant in Tokyo, and just the labor of love and perfection that they got to get to. Oh, it's just fascinating. So I've watched that a number of times. That I like that one a lot. I recommend it.
Okay, this is the easiest question of the day.
Uh-oh.
Duke, Carolina, or NC State?
I'm not dumb enough to answer that question.
See, I'm actually the one in trouble for not mentioning Wake Forest. So.
That's right.
A couple of trivia questions. What product is made in North Carolina? Mount Olive pickles or Texas Pete hot sauce?
Uh-oh, is that a trick question?
It is a trick question.
Oh God, I guess it's the Texas Pete hot sauce?
They're both made in North
Oh
Carolina.
God, okay, there you go. Oh, that wasn't fair.
All right, this is a final question.
Okay.
We often work long hours at DHHS. How many times a day do a clock's hands overlap?
24?
See, I went to the University of Google last night, and it's 22 times. So, yes,
22.
I've got the formula here. We can discuss it later.
I guess
so.
every time it's 12, it doesn't, I don't know.
I
What
think,
is it?
yeah. there's-
Okay, all right. I
I'll
messed
draw
it
it
up.
out.
All right, there you go.
Just one final question.
And I like numbers too, so I'm very disappointed in myself. Okay.
Finally, everyone's here.
I know,
Everyone here
thank you for coming.
want to support you. How can we best support you in your new role?
So teach me everything I need to know, and serve the patients, community members, families, and serve our customers and serve them well. We'll talk more about this likely at our next staff meeting, but think about what brings you joy in your life and bring that to work every day. Bring your A game every single day, because our folks need it. The folks we serve need it. And if we're not joyful here in the work as a family that we do here, it's harder to serve those who are in need, because it's a hard job to serve the community. And so we need to make sure we're taking care of ourselves, that we're supporting each other, we're thinking about what brings us joy, and making sure that work and joy are closely linked. And so if you can be thinking about that, as well as teaching me what I need to know to be successful, and focusing on the community and the people we serve, we've already won. Okay, so we're gonna break for now. I look forward to having our next staff meeting. I think we'll do it outside, so we get a little more fresh air for everyone. And just thank you so much for coming today. I look forward to getting to know all of you personally. Feel free to come up, introduce yourself as you can, and let's get to work. Thanks.